All right, welcome back, everyone. Welcome, Elena. Happy to have you back on the show. Let's today, if you're open to it, let's talk about some peptides. It's been a hot topic for a number of years now, and everybody's talking about them. Everybody's buying them, selling them. It's almost like a taxi driver is talking about how great peptides are. And there's a lot of myths and really cautionary tales out there that I think are important to address.
Hi, Tatiana. Thank you for introducing me and thank you for having me on today. Um, we could start just talking about peptides, what they are, because a lot of people just hear peptides. Some don't know what I'm talking about, and some people are, they hear of things, but they don't really know much. So, what are peptides? Peptides are short chains of amino acids linked together by peptide bonds. They form through a condensation reaction between the carboxyl group of one amino acid and another group. They're classified on the number of amino acids they contain. So, to put it in simple terms, they play a nice versatile role in many of the biological functions, including acting as hormones, neurotransmitters, and growth factors. So, peptides basically help our bodies function, and when you're introducing an outside peptide, you're basically, to make it simple, enhancing how your body works. So there's a lot of different peptides. Some are FDA approved, some are not. Um, you
And
want to
so,
start out with a question?
sure. I mean, peptides are already naturally occurring chains in our bodies, right? And from what I understand, in our bodies, protein breaks down into amino acids through the digestive process, and then amino acids are consist of peptides, essentially long chain peptides. Is that accurate?
So, amino acids are basically small organic molecules that serve as the fundamental building blocks of peptides and proteins. So, each amino acid consists of an amino group, and it basically combines to form sequences of peptides. Uh, so, you are correct. I mean, they go hand in hand with each other.
Awesome. And so these, I guess, synthetic peptides that are external, right? They are short chain peptides, which, from what I heard, they don't really form any sort of dependency or any sort of, they don't accumulate in the body, right? So they're, if done properly, they could be potentially very beneficial, but there are a lot of obviously risks associated with them as well, right?
Yes, correct. So, um, peptides can be very good when they're used appropriately and when the source is good. So when someone doesn't really know anything about peptides and they just kind of Google it and try to buy it and use it, it's not really a good idea because A, they don't know where they're getting it from and who's selling it from. It could be just something from China coming that doesn't actually have any of the peptide in it, even though they're marketing it as that. And unfortunately, the person cannot really tell the difference. They could just be spending money on something and injecting, I don't know, saline inside themselves, and they don't even know. So when they don't see a difference, or when they're hurting their body, and some of their liver enzymes or anything else goes off, it might be that. So there, when you do get a peptide from a healthcare professional that knows what they're doing and where they're getting it from, and that it's definitely good quality, then you could see a really good benefit to taking it. It could improve anything in your body. I mean, there's peptides for literally almost anything. Some of them are FDA approved, so those are a little bit easier to understand if you're getting the right type and what it contains, because the FDA does regulate it. So the weight loss peptides, for sure, you know what you're getting.
Nice. And I mean, you're gonna talk a little bit more about kind of the sourcing of it too. I can kind of briefly touch on it. I think that's would be beneficial for somebody watching. It's there are a couple of different ways that FDA is regulating it, and they're trying to regulate the quality of production more. Hopefully they do, because there are people at the gym who are reselling peptides to everyone, and they're just basically giving them, oh, inject this much and inject, inject here, inject this often, which to me is like, okay, like people are following it because they trust that person, but then you're like, they're not a medical professional. They've like, we are so different. We're all so different. The bio individuality, I think, is super critical here, and also in terms of providers, right? So like the weight loss peptides are great when done properly, but just overall, talk through a little bit more about how doing it on your own versus doing it through a provider who's educated in peptides, who has done research, who has looked at research that's been done, like what kind of a difference it could make, maybe even with an example, if you
Okay,
know.
so um, I think I spoke to someone in the past that basically said, okay, peptides are not good. My friend took them, and she ended up in the doctor's office with elevated liver enzymes. So they're bad. They're not good. Obviously, I'd rather inject Botox instead of using peptides because peptides are bad. And I'm like, really? Where did she get it from? So not really sure where the source is, and even her, she claims it was through a healthcare professional. I'm not really sure if it really was or not. And then we can go to an example that um, someone basically went to a functional provider, got peptides to either lose visceral fat or just have more energy, cognitive enhancement, and they feel much better. They have more energy. They lost weight and they're much healthier. Even you could check, you could see certain indicators on the lab results. And peptides, I mean, peptides are not really, I think, meant to be taken every single day for the rest of your life. I don't think it's something that's necessary, but it's definitely helpful to boost while you're on it and just to get to your goal. And then once you enhance your health and what you want it to do, then you could slowly kind of stop taking it. You could take it maybe like more infrequently and then kind of let go if the rest of your lifestyle allows it. Um, and I think that's the best way to do it because, like I said, you have a practitioner actually monitoring your progress and not, oh, all of a sudden you don't know where you're getting it from. You don't know who's giving it to you. You don't really know what's in it and you don't see any effect.
Yeah, I've heard a couple of stories where providers, because I do work with a number of providers, where providers basically were saying, like, we tried a different lab because certain peptides you can get from a 503A regulated pharmacy, 503B regulated pharmacy, different um, regulation or whatever associated with that, and certain ones that they're hoping to regulate are just coming from a lab, and hopefully the lab follows all of the 503A rules and sanitary conditions and things like that. So sourcing definitely matters, not just sourcing for the raw material, active pharmaceutical ingredient API, but also just to make sure that the facility operates at the standards of a 503A pharmacy, for example, right? So this one provider mentioned that she ordered from like a new lab a certain thing, and the patient noticed no effect. Where before, the same peptide was used from a different lab, and they were noticing changes as they were injecting it. And so that definitely stands out, when you're just injecting and you're not really feeling the effects, right? Like simple things like that. But then sometimes providers do their best, and usually, I really like my provider, my personal doctor back in the day. I had to ask him 3 times for a weight loss peptide because I was like, he wanted to make sure that I understand kind of the risk and responsibility. Like in my example, it was I needed to lose 50 pounds, and he was like, you realize that with this peptide, you are going to be losing bone. Not a good thing. So you need to exercise, you need to increase your protein intake and all of this stuff. And so I was like, okay, give me the list of what I need to do and I'll do it. And I did. I started on the peptide. I started exercising daily. I started taking extra protein every day to make sure that my protein intake is optimized. Not too much, not too little, because if it's too much, it burns a sugar, burns into sugar and stuff. And so all of those different things. Do you think it's even possible for somebody to figure that out on their own?
No, I don't think so. Because any person, they don't have access to certain things. I mean, the only thing you could see is if you inject and you see a difference, but otherwise, there's no way of figuring it out unless A, it's too late and say there's a negative effect to it, or I don't know, you somehow get lucky and you get the actual peptide. But it's like playing Russian roulette. It's like, let's pull the trigger and just see if it works or not. Because I don't know, it's kind of like buying vitamins off Amazon. You don't know what you're gonna get.
It's true. There's been reports of vitamins through Amazon, because Amazon is not the only one that's sourcing and selling it. They also allow other people, third party resellers, to sell it, and that's where
The
the
issue.
usually they've been tests that showed that let's see, it's not even only the supplements. Here's the funny thing: the when I was ordering dumbbells, because I needed a set, but then I also wanted some higher weight dumbbells. They also do that to dumbbells. Like there are certain brands that sell dumbbells, like don't like the weight that they advertise, like 20 pounds is actually like 19.5 or 19.2 or like 20 and a half. Like, so it's not never like a 20-pound weight, for example, and stuff like that. So, I mean, with supplements, the same thing. It's a third party reseller. Amazon resells it, but they don't verify the source and stuff, right? So it happens to it all the time. And so I guess if you were to describe a how these peptides should be done properly, and maybe give two different examples of like one with a weight loss, one with like other overall health peptides or whatever that is. What would that ideally look like as a process? Like somebody thinks, okay, I'm curious about weight loss peptide. I need a little help. What does this person do next?
So, for example, weight loss. I mean, okay, so like I said, you're not supposed to, at least in my opinion, you're not supposed to be taking this for life because of some of the things you named, what the side effects might be. Unfortunately, I've been to one too many pharmaceutical dinners, and they think that actually taking it for life might be a good idea. And I mean, when I asked, I'm like, okay, so how long are you supposed to take this for? Just to know what the pharmaceutical company expects. They're like, oh, you could just continue taking it. As soon as long as you're taking it, you've lost weight. I'm like, okay, but this can't be healthy. So, they have no problem for you to just keep taking it, not exercising, and you'll slowly, obviously, develop some issues. Or you could do the right way. So, what's the way it's figured out? First of all, it's not like there's only one peptide for weight loss. So it's not like you go there and okay, I want this. How do you know what you want? There's an algorithm to how to choose it. For example, if there's a certain amount of weight loss that you want to do, like, are you trying to lose 10 pounds, 15 or more, 15 or less? Because that determines one answer as to what peptide you're going to use. Um, do you want to inject? Do you not want to inject? Because theoretically speaking, if you don't want to inject, the oral peptides might not be as effective. Depends for what. Or they could be effective, but I mean, you might as well just go to the gym because you're going to get the same outcome. If a year losing 10 pounds in a year, I mean, come on, you could do that on your own,
That's
theoretically
right.
speaking, with the right guidance. So it depends. It really depends. It's like, okay, well, and then once you start taking a peptide, and you're like, okay, I'm getting these side effects. It's going like, who do you ask if you're doing this by yourself? I've had patients, by the way, that totally basically said, okay, so I'm on semaglutide, but this and this I'm feeling. I'm like, okay, so who gave this to you? Oh, my friend got it for me. Like, okay. So who do you
Jeez.
go to if you're having issues? I don't know. I'm like, okay,
That,
that's
that's why
great.
I'm asking you, right?
I'm like,
Wow.
you can't ask me because I don't even know what you're taking. Like, I'm not taking responsibility for this. Um, so, for example, you're feeling nauseous, and like, what dose are you on? When are you taking it? And you're not eating anything. You're losing muscle mass. Like, there's a lot of issues that have to be addressed. So if someone is actually looking over this, a lot of things can be prevented. Otherwise, you're just taking things and you really have no idea what you're doing. It's like people that, I think I need vitamins. Let me just take a multivitamin. Although, what are you really missing? I tell people, why do you need a multivitamin? You should either incorporate everything in your diet or you should test yourself to see what you're actually deficient in and not just take vitamins just to take them, because that could also be
Yeah.
harmful.
Yeah. Well, I've heard that, and I don't know, there are a couple of like people like Rhonda Patrick, for example, they say that multivitamin is actually good, but then other doctors, and I don't remember who the doctor was, or a couple of doctors that I've seen talk about how multivitamins are completely useless because they just attempt to give you multivitamins, but then the dosages are not even close to what you might be needing, or some of them might be too much, some of them might be too little, and all of this stuff. So I agree. It's almost like a self-serve peptides is almost like an equivalent of like a multivitamin. Sounds like.
Except it could be even worse.
Except you can have side effects and things like that. That's growing a third ear. I mean, is it exaggerating? Yeah, sure, but somewhere in between nothing and growing a third ear could potentially happen.
Or your body slowly breaking down on itself when you're
Yeah.
taking things. Like, I'm like, I was looking at someone's blood test. I'm like, why is your kidney function a little off? Like, it's not like if they went to a regular practitioner, they might be, they might think everything is fine because it's still within normal range. But I'm like, it's higher than it should be for your age. What are you taking? I'm not taking anything. I'm like, you sure? And then it comes out, I'm taking creatine,
Uh-huh.
creatinine, creatine,
Creatine, yeah,
creatine,
creatine.
creatine powder.
Yeah,
I'm like, why are you taking that? It helps me with energy. I'm like, maybe there's another reason why you don't have the energy.
that's right. Maybe let's look
So
at your iron or ferritin, right, or whatever that is.
yeah, exactly. So they're taking it, and I'm like, you're slowly killing your kidneys. So
Wow,
stop it.
that's crazy. Yeah, I mean, my experience has been interesting. Like years ago, when I first did my food sensitivity test, and I removed all of the foods that I was highly sensitive to, like that came out on the red for immunoglobulin reactions. I removed all of those, and I removed all sugars, like no fruit, nothing. And in 3.5 months, I lost 35 pounds without an issue. Like it was easy. And so a lot of people now on especially weight loss drugs, what they're not doing is they're not doing what I did. They're not helping their body reduce inflammation. I mean, the peptide itself is kind of anti-inflammatory and has those properties, right? But if you're not making lifestyle changes, you can not only gain your weight back, but you can also lose bone density. As in addition to that, lose muscle mass and all kinds of things. And what does that look like when you do? When you, let's say, women are, I guess, a little bit more prone to bone density loss, right? Especially closer to 40s and 50s and post 50s. Um, what does that look like? Just kind of like as a long term effect, like what could go wrong when somebody's not making the changes, but are taking peptides, not watching what they eat, and they follow like a, this is considered healthy, where it's maybe healthy for most people, but for you personally could be poison.
So they could have like muscle wasting. They could have, like you said, loss of bone density. Um, the thing is, everyone wants a magic pill to fix their problems without putting in the effort, which unfortunately does not fully exist.
actually doesn't exist at all, does it?
No, only close. But people also, they're like, okay, just give me this peptide. Oh, great, I have diabetes, so it's covered by my insurance. Otherwise, maybe I'll think about taking it. They don't want to spend money on their health. They don't want to put in energy and time. And a lot of people are like, okay, but I've tried doing everything to lose weight. And I'm like, did you really try everything? Yes, I eat healthy. What do you eat? I eat a sandwich in the morning. I eat a bagel. I'm like, that's not really healthy. I walk a lot. I'm like, okay, well, you're supposed to walk. That's like a baseline, function. Have you done any weights? Have you done any like high intensity workouts? No, no. So have you really done everything? Probably not. So when you're frustrated that nothing's happening, it's because you haven't really tried anything and you just don't know any better. And most patients are pretty much like this. I pretty much get the same response on an average basis where they think they've done everything, but they don't know what everything is because we don't do a good job in America to educate the population about how to really be healthy. And, the food quality is pretty terrible. From like, what do you eat? Anything boxed that just shouldn't even be going in your mouth because you don't know what's in it. And then anything that grows on trees, now you have to worry about pesticides or other things that are being sprayed. So, what do you eat? Or
Yeah.
the meat, like where is it? What is it? What is the meat that you're eating? So
Yeah.
it's very hard to be truly healthy, especially when people think that whole wheat bread is a staple of their diet.
Yeah. The whole wheat bread is a whole other thing. Yeah, like white rice and brown rice, right? Brown rice is was considered healthy, and a lot of people were eating brown rice. And then a couple of functional doctors said, you know what? Like, oh, actually, it was Dr. Gundry in his book, The Plant Paradox, who said that, brown rice has a lot of lectins because of the weight, what's preserved, and lectins for many people destroy the lining of their gut. And so people who thought they were eating healthy were like, what? So now you're supposed to eat white rice. But then functional doctors take it a step further where they say, okay, not only you can eat white rice, but here's what you do: turn it into a complex carb, cook it, let it um, cool down, and then reheat it and eat it afterwards. That turns a carb into from a simple to a complex carb, which is much better for you. We still need carbs. Low carb diet is not. I mean, it's a thing certainly, but our body still needs carbs. And so why not choose better carbs? Stuff like that.
Because
There's no
people don't
education.
know. People don't know
Yeah.
what carbs are or what they should be eating, and that's why no one. It's not part of your education in public school. They don't. No one teaches you nutrition. I don't remember ever having a nutrition course in school, or if I did, it was like maybe once in the 12 years you go to school. No one spends time to educate you. People just kind of trust what doctors say. Unfortunately, there's no standard because one doctor could tell you one thing, another doctor could tell you the same, even though they went to the same medical school. But also, medical school doesn't teach you these certain things. It doesn't teach you, nutrition. It's like go make an appointment with a dietitian. They could
Nutrition.
teach you
Yeah.
about it. Let them focus on it. And also depends who you go to for that. Because if you don't go to a good quality one, they might be giving you the wrong advice as well.
Yeah. I think I asked a doctor once, an MD. I think he's a physician. He's an orthopedic surgeon, but then um, the orthopedic surgery was a part of fellowship or whatever, like, or residency or whatever that is, right? Um, and so I asked him, like, why do doctors in the U.S. not tell people that, like if someone got diagnosed with cancer, that you should stop eating everything that cancer grows on, and that's sugar, and that's dairy, because dairy has lactose, sugar. It's all kinds of breads and gluten. because it destroys the lining of your gut. That actually is responsible for making sure that you get the nutrients that you need to support your body. That no fruits, no sugars, and a lot of stuff has added sugar, like ketchup, things like that. But nobody tells them that. And this guy was like, this guy's response was, because I'm not a dietitian, I'm not a nutritionist. And I'm like, to me, that's mind blowing. How do you like? How do you at least not mention it to the patient who just got diagnosed with cancer? Like, listen, you have to change, and you have a higher rate of survival or higher chance of survival if you like starve cancer of what it grows on, which is sugar. So, to me, it was like, I think he said they get like a 1 semester of nutrition. I think that's what it was in medical school.
And you don't know how
It's
much they're
like,
learning off of that either.
and I was like, wow, like in the US, medical school is 3 years, right? I think.
No, 4 years. Well,
It,
most programs are 4 years. They have like a couple like lately accelerated 3-year programs.
great. We want accelerated doctors who are using ChatGPT to pass their tests. That's
No,
awesome.
accelerated usually just means they have school through the summers instead of having the summers off. So
I
they're
see.
still getting the same amount of hours, just different format.
Hopefully. Hopefully.
Hopefully.
But like
Um,
in Russia, for example, in Belarus, medical school is 7 years. 7 years. And it includes, of course, the practical, the labs, the whatever built into the program, but it's a 7 year commitment.
Here, technically, it is too, because the minimum residency is 3 years after school.
Yeah,
So,
but like, are you learning if you're only having, a semester of nutrition? Like, to me, like, how?
well, I mean, their focus is not nutrition, it's prescribing. Although you could argue they're not pharmacists either, but they have no problem prescribing everything.
I guess it's just the system is definitely broken. But bringing it back to peptides, like like when you work with patients who come to you and say, "I want peptides," they've heard about it, they're excited about it. Like, where do you start with them typically?
You start with them by, first of all, getting a baseline of their labs just to see if anything's wrong prior. And then you discuss what they want and you see if, first of all, is there some kind of deficiency that's causing this? If not, everything's fairly okay, then you could technically start a peptide, but you would monitor them more closely within the first 3 months. You definitely have a 3 month follow up, but you would in the first 3 months definitely get a hold and say, hey, is everything okay? Are you feeling okay? Any side effects? Just to monitor them properly. But yeah, I think initially you have to get a baseline blood work just to see what's going on in their body.
Yeah. And also, I know you've mentioned this not on this call, but you've mentioned this before, where even for supplements, right? If somebody's taking a lot of supplements, like I do, right? Periodically, we would want to see how the liver is processing all of those, right? Like liver function and stuff. Because what is that like? What does that mean to you if you see that something is off on like the liver function, for example?
That means someone's, first of all, you have to ask if they're taking anything. It could, I mean, anything between, it could be a medication or it could be a supplement. I think when someone is being put on something, I think it's definitely important to do a liver cleanse from time to time to kind of clear out the liver. Um, and I think that usually prevents the liver enzymes from climbing. I mean, the liver enzymes could potentially be increased for a short period of time, and that's okay, but not for a long period of time. Like I said, I think it's definitely important to do a liver cleanse here and there.
How often would you do a liver cleanse, for example?
So it depends on the person. If it's someone that's fairly healthy, I think once a year is enough. If someone's having maybe hormonal imbalances, one of the ways to get rid of excessive estrogen is to cleanse the liver.
Well, that's cool. I didn't know that. I know a lot, but not that.
Yeah, so supposedly it helps with hormonal balance by cleansing the liver.
That's
And
cool.
if someone's on hardcore medications that causes liver enzyme abnormality, they definitely should be doing it at least, I don't know, at least twice a year, if not more. It depends on the person. It's not like everyone's the same.
Yeah, yeah. And what kind of do you have any sort of interesting thoughts on liver cleanse methods? I mean, there's probably a million of them in Google.
Yeah, so there's a lot of supplements out there. Um, I mean, just as an example, there's the supplement called by Standard Processing called Lifco, and it has ro- Shisandra. It has some herbs that people won't typically know what's in it, but something called Shisandra. I don't remember the exact what the ingredients are. It could be something as simple as like dandelion supplement. They carry that in liquid or in pills. Could be something called milk thistle. Also, taking this too much, also not a good idea. Everything has a balance to it. um, there's different companies. There's a lot of different ways. It's not, it's not just one way of doing it. Usually, there's something called Todka also. I don't know if I recommend just buying something random. uh,
But you have a protocol kind of, right, that you could
yeah, I mean,
recommend if somebody
there's
needed.
correct. There's more than one way of doing it. Depends on what the patient prefers. Also, some people want to do only liquid. Some people want to do pills. Um, and a lot of times, what it does is it makes you go to the bathroom more.
Which kind of makes sense. So you have to be drinking more water, I guess.
Correct. So you can remove the waste out and to clean it through, and probably limit alcohol because alcohol definitely takes a toll on the body, especially when you're trying to clean out the liver. Incorporating like leafy greens, garlic, turmeric, all these certain foods also definitely helps. Um,
Interestingly, I'm highly sensitive to turmeric, so I can't have that.
okay, it's not a
To
it's
me,
not
it's
an
poison.
absolute.
Yeah.
Some people could drink warm water. Warm water in the morning definitely helps. Adding, I think, a little lemon to it. There's certain things that anyone could do, which definitely also cleanse the liver. There's so many ways of doing it. Um, there's there's other companies out there that also aim to do it very well. If you had patients use it, and definitely helps, especially for patients that are bloated or constipated.
Nice. So to kind of sum it up and to wrap up this episode, what would be your kind of top three recommendations for somebody who's curious about peptides? Maybe weight loss, maybe not. There's 70 plus different commercial peptides, right? With research and everything on them. And so, what would you recommend to someone who would like to explore or just is curious about it but wants to do it right?
So I'd recommend to see a proper functional medicine provider to even evaluate if they're a candidate for it. But usually, if you really want something and you really want to improve the right way, you need to see someone for it. Someone that knows a little more, and someone that knows where to source the proper peptides from, and someone that could actually monitor the patient. I mean, we do it at Vitaline Health.
Awesome. Yeah, cool. So hopefully everybody's who's watching or listening, because we're on both YouTube and other platforms for audio. Hopefully you've gotten some really good introductory information, but the baseline and the goal of this episode was really to show you how to not make mistakes, how to not damage your body by trying to DIY it. Yes, it costs money to see a provider. Yes, it costs money to get the advice, but then your health really should be worth it, right? Really should be priority as opposed to just buying off of a gym instructor and things like that, and not really understanding where stuff's coming from, and maybe not even getting a benefit. I mean, I think not getting a benefit or seeing a result at all, I think is probably the best scenario, best case scenario, versus like getting a negative benefit. Like, right? Hopefully, for peptides that are sold through and are not really produced correctly, or not, there's no oversight or control or anything like that. Hopefully, it's just saline that replaces the peptide to be, but hopefully, it's not anything that's damaging to the body, right?
Yeah, definitely agreed. Um, it's better to have no effect than having a negative effect, and also it costs money to fix those effects too, if you want to look at it that way. And if you really want to improve your health and you want to do it correctly, obviously, as anything that costs money, nothing in this world is free. And if you're trusting your health to someone else, so realistically, the best way to do is just get evaluated by a proper practitioner and not just Google things and just go out and buy whatever you want and let's test it out on ourselves and then let's go to our primary doctor and see what's going on and tell them, hey, I got this from a friend.
And
um,
you're certified in peptides, right? You have the certification and stuff.
yes, yeah, yes, correct.
So So I remember you saying a couple of times that people, who have cancer, which they may or may not know about in their body, really should not be doing any peptides, right?
So theoretically, yes, but there is actually a peptide that in other countries is used in conjunction with chemotherapy, for example. And the peptide is to enhance the immune system function. So with chemotherapy, just as an example, you're really killing off everything and you're really suppressing the immune system. And it's kind of like, let's see how much we could kill and see if the patient survives it or not. So this peptide could actually make the body stronger to tolerate the, I guess, the medical abuse, so to speak, like to kill off the cancer. Let's see, it kind of repletes you back. So I can't say like, okay, you could go and do any peptide you want, but there's definitely maybe like one or two peptides that are used as protocols in other countries, not in the United States, but in other countries they
Yeah,
are definitely used, and I'm pretty sure there's some kind of definitely benefit to it.
nice. And also, there are protocols out there that have been research tested by medical professionals for probably close to a decade, right? And so, in terms of I also remember you mentioned, and we're going to wrap this up in a minute, but you mentioned before that you really shouldn't be, or really shouldn't be doing more than one or two peptide protocols at a time. Do you agree? Do you remember?
So peptides can be, I guess the verbiage is called stacked. So you could have multiple peptides in one either concentration. So it's hard to explain protocol. I mean, I would say you would focus on one thing at a time. I wouldn't just say like, oh, I want to lose weight and I want to improve cognitive function. I want to look new and beautiful and I don't want to age. Like, enough. Let's do one thing at a time. So if you want to, if what's your top thing first? You can't just overwhelm yourself with 10 different things at once. You can stack the peptides, meaning you could do 2 to 4 at once, but it's usually for the same goal. Like there are peptide stacks, like a mix of different peptides in one blend, and that's okay. But that's not the same thing as, and then let's put let's put a weight loss one on, and let's do a cognitive one, and let's do this, like one goal at a time, whatever is the most important. I think too much too soon is overkill also.
Yeah, that's nice. Yeah. Thanks so much for all the insights. We'll be back with more episodes on this, and thanks
We
so
could
much for
discuss
providing.
peptides, one at a time, what different peptide there are for different uses next time.
Yeah, absolutely. Sounds good. Thank you, Elena.
All right, thank you.